Infectious disease specialist from the PIIC Center, Dr. Donna O'Neill. Good morning.
Good morning.
Good morning.
Sorry, I'm going to talk about COVID again. The impetus for today's talk was a patient yesterday in the clinic.
Okay.
Late 80s, getting the monoclonal antibody, pretty sick. I think she had early pneumonia.
Oh, wow.
And she said to me she's under-vaccinated because her last dose of the vaccine was last November, and she hasn't had any illness this year. And she said she didn't know there was another vaccine out there and that she should get vaccinated. So that's why we're talking about it again. But before we start, question for you guys. It's an easy one, Andy.
Okay, well.
Do you think the pandemic is over?
Technically, no, it can't be over.
No, no.
You know, President Biden on 60 Minutes said it was. So, which is unfortunate because I don't know
I think
it's unfair to him because if you listen to the whole clip, you know, he said, we still have a lot of work that we're doing on it. But people just listen to that little snippet, and when they hear that, they're thinking, well, we don't have to get vaccinated. It's gone. And you're right, it's not.
Yeah,
but
I think you can go weeks thinking it's gone, and then something happens where it's back, and that could be maybe something that you're going to or someone that you're meeting with has been affected, and it constantly reminds you that it is still here.
Yeah, I think we need to be flexible because that's where, we let the public down. And it was an interesting question. It came up in our team huddle yesterday because that's what patients are saying. Is it gone? And there's not a really good definition for it. There's no good metrics for it.
Sure.
And I think it depends if you're a physician, if you're a teacher, if you're a business person looking at the economy. But to be honest with you, Brandon, what do you think? Is the pandemic gone?
No, absolutely not.
Okay, well, because, I think a lot of people have decided it is because they've gone back to doing everything they want to do pre-pandemic. It's around 47%, but I think it's around 58% still are concerned about it. So, yeah, it's still out there.
Well, we were just traveling and we saw very little evidence of a pandemic. And one of the things I've noticed over the last handful of months, when we first were being careful, we were giving each other 5 or 6 feet of space between in lines, like at the coffee shop.
Oh yeah, lines.
There's no lines. I mean, there's no space. People are on top of one another. And we heard from someone last week, someone got sneezed on and they ended up sick. But
yes, they did.
So that's an unfortunate situation because at times I think we're going to have to pull those tools out of our toolkit because we're really depending upon the vaccine and it can't do the job alone. And I think we're setting it up for failure, quite honestly. So
is kind of jumping around here. Are there some longer symptoms that you've seen people struggling with?
That's a big topic, that long COVID.
Yeah.
There's poorly understood. These are symptoms that continue 3 months after the infection. And we've seen it with other infectious diseases. It's gone by different names over the years. Chronic fatigue. It's got a fancy name now, but most people recall chronic fatigue. And one of the most disabling things is this brain fog. I mean, people just are having a lot of cognitive issues.
Right.
Sometimes it's trouble with their breathing, sometimes fatigue. We could talk the whole show about that, but I don't want to.
Okay.
All I can say is we're in a much different place now than what we were in 2020. We know a lot more. At least I hope and I believe that the worst is over and our case rates have gone down. But we're still losing 300 to 400 people a day in the United States. It's affecting 70,000 people in the United States. Worldwide, 2,000 deaths. 500,000 people are getting infected. So from the scientific point of view, no, the pandemic's not over. The end is getting closer. Some people believe it won't be over until 2024. So who knows? So I wanted to kind of concentrate on what the virus is doing. It's unpredictable. So it keeps changing. It's become more transmissible. They figure 80% of the U.S. has had Omicron, whereas in a typical flu season, it's around 20%.
Really? Wow.
Yeah, so very transmissible. It's getting really good at evading our therapeutics. And we know from other cold viruses, we don't have long-term protection, and that's why these vaccines even if you've had the infection, are still needed. So I only have one slide. I hope we have the right one. I wanted to show it's again affecting our older folks. So since September, 88% of our deaths were in people over the age of 65. And in that purple line, this is the deaths in the US. And the purple line are people over the age of 75. And you can see the gap between them and other age groups, has always been greater. So that's who it's really affecting right now. So especially if you're in that age group and you haven't been vaccinated since last year, I encourage you to please go get vaccinated. That's all I wanted to show with that. The other thing, got my little whiteboard. I tried to condense a lot of medical data. The other thing that I wanted to show, so this is looking at the time course of hospitalized patients. So with Delta, Omicron 1, and that goes up to March of 22, and then Omicron 2, this is data from the end of May. You can see that the age of people hospitalized is getting greater. NH means nursing homes, so a proportion of people being admitted to hospital is increasing from nursing homes. Immunocompromised hosts, those are the people, with cancer and those potent drugs to treat, all those rheumatology and GI conditions, that's increasing. Medical conditions is increasing. The good thing is our death rate is going down.
Oh, that's good.
So we don't know if that's because the Omicron is less virulent, if it's because people have had the infection or the vaccine, but that's the good news. So that's all I wanted to show with that.
Have you heard of anyone post-COVID having tons of nasal drainage every single morning?
Like you?
Yeah, like the last 3 months.
Sure, if that's, there's just so much we don't know about it.
I'm assuming that I had COVID at some point and now I have this long haul
Probably
symptom.
Omicron.
Yes.
Yeah, this year.
Probably, if 80% of us have had it. Yeah, it's amazing.
Yeah, it's a lot.
The interest in getting vaccines has waned considerably. I talked to a pharmacist last week.
Austin.
And yes, Austin Brown. And he said, well, the clinics, the drive-through clinics, we're just not getting the people to sign up for them, so we're just doing them in the pharmacy. And for the most part, I think that's pretty universal.
We have to make it easy for people. So many people have said when they come to the office, you have to sign online, and the older folks sometimes don't want to do all of that online stuff.
Yeah.
But I don't know where the disconnect is, and that's why, unfortunately, we're talking about it again. And unvaccinated patients, that's the other group that it's hitting. So their risk of hospitalization has gone down, but it's still 5-fold greater than if you were vaccinated for any age group.
Well, one of the earliest problems in the pandemic was the poor communication by government authorities on what to do, when, where, and there were conflicting instructions from different components of federal government, different instructions here in the state, and I believe since it's now election season, there's not an interest in discussing it.
I think
it's like, put that in the past. We don't want to talk about that. It's not going to help me get elected.
I think you'd rather talk about that than inflation, if you ask me.
Think.
Yeah, I remember with the H1N1, I think it was in 2009, and there's a female head of the CDC. There was no interference. She had direct access to the media. There aren't all these other people within government, giving different messages. And I think we've confused people. It's very complex. Unfortunately, physicians, we're not trained in, communication. So, we do it all the time. But we don't have that media training, So now I think within the CDC they're doing that. But it's uncovered a lot of problems, but I don't think we're learning from our mistakes. And so that's why I'm encouraging people. It's still killing people. I know we've changed the goalpost. Before we said we would be happy if it was like flu.
Yeah.
So that kills when it's in the community or in the country about 100 people per day. And so now we're accepting 400 deaths a day.
Crazy, right? When should we get our flu shot this year? timing.
Whenever.
Anytime.
So I mean, between a COVID shot and a flu shot, if you're only going to get one, I'd get a COVID shot right now. And so I mean, again, the messaging is confusing, like who should get it? So what I'm trying to emphasize today is older folks should get it. And what's the definition of that? The older I get, the number goes up, but some people say greater than 50, greater than 60, greater than 65. I mean, anybody, you know, depending upon the vaccine over the age of 12 can get it, but definitely the older risk groups, people who have underlying medical conditions, immunocompromised host. I mean, you could get it because you don't want to get, you know, hopefully a severe disease. You don't want to get sick at all. You don't want it to disrupt your show, your child's school. You want to do it because you want to protect your grandmother, you know, who's in a nursing home. And then that you brought up the entity long COVID. Do the vaccines prevent that? You know, we don't know.
Yeah.
You know, so some of the things, you know, we've done, I mean, I know some people before they see their grandmother in the nursing home, they do a rapid test again. The other thing we have to realize is now it's going to be commercialized. So maybe that's what President Biden meant, because by 2023, the federal government wants to get out of it. So already, you know, remdesivir, once it got FDA approved, the government wasn't going to pay for it. The monoclonal antibody, once my stock has expired, I was getting it, you know, for free from the government. I'll have to buy it for patients, and then it'll be charged to their insurance company. The vaccine is still free, and the pills are still free. But they want to get out of the, I mean, the test no longer, they shipping, well, I guess your insurance companies can ship you tests, but directly from the federal government, that's going away. And that on its own is going to cause a lot of problems. Because, you know, to be honest with you, pharmaceutical companies aren't interested in infectious diseases. Why? Because you're on treatment for what? A week or two?
Right.
You know, so compare that versus a blood pressure pill that you're going to be on the rest of your life. So without that federal government pushing, you know, the vaccines, and we wouldn't be where we're at today. So it's a shame that we have great vaccines. How great they are, we don't know, and they may not be perfect, but hopefully they're good enough. And you know, because we changed which vaccine we're going to use, we don't have a clinical trial. I'll be honest about that. And we may never get these clinical trials because it's moving so fast. The virus is changing, our response is changing. You know, we may find the older vaccines are better than this new one. I didn't realize until recently that, you know, it's a bivalent vaccine. It's got the old strain and now Omicron 5 in it. But what they've done is they've reduced the dose of each component. So the dose that you're getting of the old strain is similar to what children get, but when you combine the two, it's, you know, a full dose. So we'll have to see how that pans out. So there's a lot that we don't know, but please, 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 I encourage people to get their vaccine.
Thank you so much for being with us today, and thanks for dropping the knowledge as always.
You're welcome.
Dr. Donna O'Neill on The Morning Show. More after this